Unit 1.4, Video 3. Frequent non-communicable diseases in people with acquired disability. In this third video of the unit, we will discuss a little bit those non-communicable diseases that are often associated with a condition of acquired disability. The first three of these non-communicable diseases, they are metabolic syndrome, type 2 diabetes, cardiovascular diseases. Well, people suffering acquired disability are prone to the same non-communicable diseases of the non-disabled subjects, but due to their fragile condition, they are exposed to a higher risk. This means that bad or good lifestyle can really make the difference in terms of quality of life. Bad lifestyle habits such as reduced physical activity, poor quality of nutrition can easily lead to a disease condition, affecting negatively the quality of life and life expectancy. The first condition we are going to present is called metabolic syndrome. It is represented by a group of metabolic risk factors that exist in one person at the same time. Risk factors that can lead to the metabolic syndrome condition are represented by waist circumference, hyperglycemia, high blood triglycerides, low blood HDL, so the good cholesterol, and high blood pressure. When these risk factors are present in a person at the same time, the subject is suffering metabolic syndrome. So metabolic syndrome by itself, it is just the presence of multiple metabolic risk factors in a person. But this situation can lead on one side to a higher risk for developing cardiovascular diseases such as stroke, atherosclerosis, and so on. It is risk factor for an increased level of inflammation, and inflammation by itself, especially when it is chronic, is related to many other diseases, for example, neurodegenerative diseases. And also, the metabolic syndrome subject is more easily prone to develop type 2 diabetes. To diagnose metabolic syndrome is quite easy. It is diagnosed when at least 3 of these factors are present at the same time. So high waist circumference, high blood triglycerides, low HDL cholesterol, high blood pressure or high fasting glycemia. Metabolic syndrome is a frequent condition among people suffering acquired disability, and it is furthermore promoted by poor quality of nutrition and low level of physical activity. A study published in 2019 revealed that among veterans affected by spinal cord injury, metabolic syndrome was much more frequent with respect to the general population. Metabolic syndrome is a serious health condition. People suffering it have a higher risk of diseases related to fatty buildups in artery walls, coronary heart disease, which can lead to heart attack or stroke. People with this syndrome are also more likely to develop type 2 diabetes. Now we can quickly describe type 2 diabetes. This pathological condition is mainly related to insulin resistance, which is the state in which muscle, fat, and liver have a decreased response to insulin, resulting in greater amount of insulin secreted by the pancreas for adequate uptake of glucose into the cells. This retention of glucose in the blood leads to hyperglycemia, and over time it can lead to serious systemic damage, including injury of the heart, kidney, blood vessel, or eyes. Type 2 diabetes is defined by the chronic elevation in blood glycemia secondary to insulin resistance. At early stage of insulin resistance, blood glucose levels are higher than the normal, but not high enough to be diagnosed with type 2 diabetes. In the table on the right, we reported the level of glycemia that are considered normal, less than 100 mg per deciliter, the range called prediabetes, which is a range between 100 and 125 mg per deciliter, and when fasting glycemia is higher than 126 mg per deciliter, diabetes is usually diagnosed. In subjects suffering acquired disability, for example after spinal cord injury, skeletal muscle undergoes profound atrophy below the level of the injury. This change leads to a reduction of glucose muscle uptake and is associated with a greater intramuscular fat accumulation. Intramuscular fat accumulation is negatively correlated with the insulin sensitivity, so higher intramuscular fat accumulation is related to higher risk for developing type 2 diabetes. Moreover, type 2 diabetes is associated with an increased risk for developing neurodegenerative conditions such as Parkinson's or Alzheimer's disease. A traumatic brain injury condition increases the risk of these neurodegenerative disorders via mechanisms involving persistent neuroinflammation. So you can now understand that the presence of type 2 diabetes in subjects suffering traumatic brain injury can increase the progression or development of such kind of neurodegenerative diseases. Lifestyle changes, such as an increased sedentariness, frequently occur after traumatic brain injury, resulting in a higher risk for developing type 2 diabetes in traumatic brain injury patients. There are, of course, some symptoms to look out if type 2 diabetes is suspected. For example, the condition of polyuria, so the excessive production of urine, is very frequent in a diabetic person, but also polydipsia, so increased thirst, blurred vision, slow wound healing, weight loss or weight gain, hunger. All these are symptoms of type 2 diabetes. So please look out for these symptoms if type 2 diabetes is suspected. Acquired disability is also associated to an increased risk of cardiovascular diseases. Subjects suffering spinal cord injury are known to have a higher metabolic and cardiovascular risk in comparison to the general population, and this is also due to the changes in metabolism, but also body morphology and the relative inactivity following the injury. Long-term studies have shown that cardiovascular-related mortality is higher compared to the general population, and that the cardiovascular diseases are one of the leading causes of death in individuals with spinal cord injury. Also in people suffering traumatic brain injury, the risk for developing hypertension, cardiovascular complication is increased.